A Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. Welcome, everyone, to a TIPisode with me and Andrew this time. And I am fired up, Andrew.
You are fired up.
Oh.
You've been, yeah. This is a thing that we're going to talk about today is something that you mentioned several times on our calls when those calls weren't really supposed to be about that. And they managed to make their way into that conversation. It's very fun for all of us.
Well, you know, when something's bothering me, the entire world will know.
Absolutely.
So, and what's on my mind is the abhorrent conversation and remarks towards hygienists that came from the lobbyist Dave Marsh from the Illinois State Dental Society, and the senator who also is the first cousin of the past president of the ISDS. I mean, that's not a red flag at all. It's fine. It's not a big deal. But we're talking about this article. If you have not, been on social, or if you don't get a Google alert like I do on dental hygiene, you might have missed this article. And it's actually been repurposed in many sites. So I think if you just Googled Dave Marsh and Illinois Society or Illinois State Dental Society, you will find this article. And pretty much what happened was that they were fighting against a bill that would allow hygienists to go into like nursing facilities. And the thing, what really struck me initially about this whole situation, well, I guess there was a few things. One, I was like, oh, great, another contentious argument between dentists and hygienists. Like, will this ever end? Mm-hmm. Will we ever be on the same page in regards to allowing hygienists to work at the height of their, scope of practice? We are not trying to be dentists. We're trying to be prevention, care experts. Sometimes that does involve minimally invasive treatment like SDF and glass ionomer because maybe they can't get in to see a dentist for a very long time. And we are a great bridge to get them out of pain or prevent further destruction or continued oral disease. And then also I was like, what a slap in the face to your constituents. Mm-hmm. Mm-hmm. You are literally blocking them from receiving more than adequate oral care or access to oral care. And I just don't know what to do. I'm like, I was hoping I'd get to a place of neutral and be less ragey so I could come at it calm and think about this. But I don't know if I'm going to get there.
Do you have the quote handy of what he said?
Oh, yes.
We need to read. I feel like, so the things that you're jumping ahead of the story and you're so angry about it. And then guys, when you hear this, that you're gonna agree because it is, what do you say? Abhorrent?
It's abhorrent. It was abhorrent. And wrong.
Yeah, factually wrong too. Right, yeah.
Factually wrong. Okay, so my favorite part was I just don't feel anybody with a 2-year associate's degree is medically qualified to correct your health. They are trained, talking about hygienists, to clean teeth. They take a sharp little instrument and scrape your teeth. That's what they do. That's all they do.
That's all they do. Oh my gosh.
That is all they do.
Yep.
And this is where I'm like, it's okay. First off, this is horrible because not only, in my point of view, they are saying anybody with an associate's degree is not medically qualified to correct your health. Remind me, are some associate's degrees ending up in nursing degrees? Mm-hmm. Mm-hmm. So, I mean, are you not, let me just slap the face of so many people.
Right. I mean, there's so many different people in the healthcare field that do patient-focused or patient-centered care that have a 2-year degree, an associate's degree, or they're even subspecialties where it's only not on-the-job training, but certificate-based, not even necessarily formal education. And we're not even going to get into the whole thing about whether quote-unquote formal education or schools allow you to be competent in your job. We're not even going to go down that little alley because that's a whole different thing. But it's so frustrating that there's so much more that we're not even looking at.
Yeah, exactly. And just really the cherry on top here was the state senator, Dave Siverson. I'm not sure how to say that correctly. He's a Republican legislative leader, warned against the bills, even if they surrounded minor. I'm not really sure what that means. Warned against the bills, even if they sounded minor. Okay, there we go. I said it properly. It's not, he said, it's just getting the camel nose under the tent, which I don't understand that. Is that
that's an interesting term, but is that just to get underneath the tent so that the camel can just go live in your tent? Is that what
I guess so, because then he follows that up. Yeah, he says, well, before long, hygienists, you'll have hygienists doing work that if they wanted to do it, they should have gone to dental school for. And I'm just like, tell me you don't understand our job. We don't want to do what dentists do. I mean, you kind of did a little bit of it because you sat on the restorative side. But I mean, I can say if I had the option to do restorative, I would not do it. I don't want to. I want to go prevent that disease. And that's the role of the hygienist. So another part of this that I felt was really also ridiculous. He said, and this is Dave Marsh, I believe, still saying it, the problem is not a shortage of dental professionals, but rather a lack of dentists who can afford to accept Medicaid patients. And nobody wants to raise taxes to actually be able to reimburse dentists at higher rates. He also pointed to the scarcity of research on the benefits of dental hygienists having more professional freedom. I'm sorry, Colorado?
Mm-hmm.
Like, I mean, can we just name some states where they actually do have a little bit more autonomy? But I just found that interesting. I'm like, well, yeah, I totally agree. Like, dentists can't always afford to take like a Medicaid patient. So, like, let us.
Well, yeah, but I mean, let's be very clear about our intentions with that Medicaid patient.
Yeah.
Is not still to do the restorative side.
The dentist.
Right? Like,
yeah.
It's still a feeder system. Like, if you are a smart dentist, then you'll create as many feeder outlets into your practice as you can. And if you are a dentist who can, the best models that we see is when you have 2, 3, maybe even 4 hygienists working, and you as a dentist, like maybe one day you just go in, you have 4 hygienists working, all you do is exams all day long, and you load up your restorative schedule. You know how much production you're going to get out of that just one single day of doing that versus having to like bounce in and out of like your restorative, your endo, and your hygiene room all in one day. Like, if you had multiple hygienists out there in the community, bird dogging treatment for you, and then sending it your way, and all you have to do is a comp exam and then jump right into the restorative. You know how profitable that is? It is so good. And at the same time, we're doing the prevention side. We're giving them the skills that these patients need to prevent the disease, or therapy if needed too, right? But I feel like they're missing what the role is of what we do. We're still going to feed the dentist. We're not taking anything away from them.
Well, now just on the flip side of that, like if we actually are doing our job, we are preventing disease. I know we're not going to like snap our fingers and it's not going to happen overnight, but we are going to be reducing the need for restorative if we are able to get out there and do it on a routine basis.
Sure. I think you and I might disagree on this one. I don't think that'll ever happen. I think with the Western diet and all of the sugars and stuff I think the thing that's plaguing our whole health system in general is too overwhelming. No matter what we do, I think we're going to prevent disease on a small scale. And I think that will prevent possibly people that are kind of on the cusp from going into like from a gingivitis state into perio, or at least stabilizing perio, or doing some of those other things. Sure. But we're never going to get rid of, caries. I don't think that's
getting rid of it, but we could if we were allowed to go out into the community and we were allowed to work and get paid to do education, to do biofilm management, to talk about pH control and acidic attacks. If we were, I mean, it is so layered. It is because, I mean, we have government subsidized crap food all over. Like, it's a whole big issue. But could we help maintain? Could we place sealants? Could we talk about, controlling the acid? Could we do fluoride management on a regular basis? Like, there's all kinds of stuff that would actually decrease. And we see that in sealant, programs and stuff.
And you're right. We are going to see a decrease, but it's not going to be at the rates where there's not going to be a need for dentists, or that it's going to make even a slight dent in the amount of restorative work that needs to happen. Like that, I guess that's like big picture. It doesn't matter. I mean, we'd have to double the number of hygienists and double the reach of hygienists into other communities that aren't currently being touched for us to really make that dent that we would like to see. But I mean, just from a population standpoint, like, we would never get there. So.
No, especially when we have people out there telling us that we only have a 2-year degree and our only job is to scale teeth.
Yeah.
Like, that is it. Yeah. So I guess, I know this is a TIPisode. I guess some of my tips and suggestions and maybe call to action, if you are fired up by this, I think this is more insidious than just this article, right? Like, I think our industry, and I got real pissed off last year about this and wrote an article on my, or a blog on my website about, like, there has to be more to hygiene than this. I think we really have to reframe what we are, who we are, what we do, that our education isn't, you come into dental hygiene because there's, like, you get 4-day work week and it's pretty good hours and you clock in and out and it's not so bad. I think we really have to work against that, I guess, stereotype that that's what we are, that we just clean teeth. Making sure that you're not a part of the industry issue as far as, like, only doing bloody prophies, and, like, we are actually doing all the things that we are capable of doing: oral cancer screening, cardiovascular discussions with our patients, sleep apnea screenings, that we we do nutritional counseling, that we really get after the education of, biofilm management, like what that looks like. I think if we are just polishing, scaling, throwing some fluoride on there, then that is an issue. And then, and I know people are like, I just don't want to be a part of politics. And I'm like, oh, what a privilege. And I'm not trying to be super condescending, but a little bit, because it's a privilege to not want to be a part of politics. It is. Because what's the flip side of that? This right here. When we don't throw some money at it, we don't call our legislators, we don't get involved, it's our community, it's our profession that is going to take the hit. So even if you don't want to go out there and be, like, quote unquote politically whatever involved, just call your state senator, call your legislators, like, let them know what you do and what we as a profession, what we do matters. And just, I mean, that's bare minimum. Just remind them over and over again. And I mean, get wild and crazy and stay abreast of, like, bills that are out there that could challenge your whole scope of practice. What about you?
Almost exactly the same. I don't feel the same about politics, I think, than you do. I don't want to be involved. But you're right. This is exactly the reason why we need to be involved. And it can be multiple steps. It could be from a very, very basic to writing a check to the right person to, like, picketing and, like, standing outside, the legislators' doors, like, screaming and yelling and doing all those things. There's lots of different things that we could do. But also, gosh, I just can't say it enough times. You can't be that person that is going in and, like, look, I'm making a difference in people's lives by doing periotherapy and prevention and yay. It really does take you to be a leader inside your office, and beyond the CE classes that you're supposed to be taking anyway, it's going to be your management and leadership courses as well. You need to learn how to affect change and be a change agent in your office. And part of that is a communication class maybe that you need to take, or maybe it's a writing class so you can learn that. Because a lot of us, when we write, and I'm the worst at this, like, all my writing, you can hear my voice in it. Like, it's exactly how I think. And that's not the right way of doing things. So there's a better way of doing things. but taking courses beyond what you're normally taking. If you want to be a change agent, and don't just be okay with just doing what this person thinks that we do.
Yeah. Yeah. So if you want to read the article, best of luck. Maybe
Well,
odds
we
be in
can-
your favor. Hopefully you don't get all frustrated like I am constantly.
We'll link it in
with
the
this.
show notes though.
Yeah, there and definitely feel free to email Dave. That's real fun too. Tell Dave how abhorrent and horrible he is, and his comments are. They're trash. And if you want, you can also just go ahead and contact your state legislators and let them know who you are, what hygienists do, that there is a whole ton of us out here wanting to help them and their oral health needs. And also remind them that they also have dental insurance, and that's a luxury here in the U.S. And to not forget about the people who do not have access to care, because they're screwing them over, and they're all people that vote for them. And that's all from me.
Well, thanks everyone thanks everyone for listening. Have a great week.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.